everyone. Welcome back to another podcast. I'm Dr. Kathy Hoeft, and here I am today to talk into one of my favorite topics. Today, we're talking about how you walk, how you stand, what you may be doing too much of, and unfortunately, as we get older, not that you're old, we sometimes get foot pain. And you know what? It really hurts. Balance, totally affected by your feet. So it's really important that we work on your feet. It does matter if they hurt. It does matter if they can't do what you want them to do. It's important to make sure that you know what's going on at all times. Balance that's poor, guess what? We fall, and that causes more injuries. So good news, we are gonna totally help you with all of this today, and we're gonna go through it. This entire episode is all about feet, foot exercises, balance exercises, and how we're gonna make it so that it's not uncomfortable for you to walk from point A to point B. And we're gonna talk about shoes because it's my favorite. When you are standing, how much pain do you have? Foot pain and poor balance is one of the #1 causes of people to go to the doctors, okay? If you're standing all day long, or maybe you're walking because you have to work, you have to get up and go, or simply you're just having achy feet and you might be older, foot pain can make putting your sneaker on hard. It's uncomfortable. And that's not even discussing some of the other conditions that could affect that foot. It's really important that whether we are standing, doing things, whatever it is, that we find the right shoe for you and we make it so that it doesn't hurt. So how are we gonna do this? I'm gonna share solutions with you. There's no gimmicks in this. You have to work. I'm so sorry for that. And you have to stretch and take care of your feet. Now, if you can't feel your feet, you need to have a friend that can help you. And that's really important. So just know whatever I tell you, if you can't do it yourself, make sure you get a friend that can help you do all of the exercises and take a look at your foot on a very regular basis, because small little cuts on the bottom of your foot that you didn't feel really can cause big problems later in life, or later in the year, or that day. So it's really important that we work on it. So let's understand what is the deal with the foot. Did you know there are 26 different bones and muscles going through your foot? 26, there's a lot that can go wrong. When you go and land on your heel, okay, your foot and all the bones in your foot actually have to organize and go into this perfect positioning so that they actually can propel you forward. So that's why it's so important for your shoe wear to be right, to land on your foot correctly, and to really look at it. So people really need to take a lot of looking at your feet. You put your shoes on every day. Do you actually look at your foot? You're all thinking, did I do that? So my #1 thing I always tell people is every day, sit on the floor. Works on your balance, works on your strength, but also look at your feet. Before you put those shoes on, take a look at your foot. Look under your foot, look at your toenails, look at everything to make sure that things look right, okay? The most common, cause of foot pain is a condition called plantar fasciitis. So you'll hear almost everyone assume that's what they have, or they think that's what they have. That means that the pain is on your arch, okay? Or it's in your heel. It can be kind of on the back of your heel. It can be underneath your arch. It can be the base of your heel. It can actually be on the top of your foot. All can still be plantar fasciitis, okay? Plantar fasciitis is so tough because it's chronic. It's like one of those things for, unfortunately, you didn't wear shoes or you wore the poor shoe for, say, a couple hours and you happen to run across the street, boom, you could have plantar fasciitis. And it could last for weeks. And so that's when it's, causes a problem. So we really want to stay on top of it. Repetitive things like, I don't know, you wanted to jump all day, that could cause it. Wearing high heels when you never wear high heels and dancing all night can cause it. Standing or walking on really hard surfaces, they could all cause pain in your foot or in your arch or in your heel. What is plantar fasciitis? Well, usually, it is a weakness of the shin muscles, and a tightness of the calf muscles. The combination of the two causes pain right in the middle of your arch or in your heel. And when the muscles pull, it can actually create some bone growth. So it causes a little spur and can actually feel like it's poking into you and cause you pain. But all of the muscle tissues around it are very inflamed and very irritated, which makes it quite challenging to have relief when you're sitting or when you're standing, or especially when you're walking. But foot pain doesn't have to be the end of it. And it's also not always just about plantar fasciitis. You can have flat feet. Take a look at your feet. Do you have an arch? How about a bunion? Did you wear high heels your whole life and your toe is going the wrong direction and it's not going straight? How about really high arches? All of those things can cause your feet to hurt at one point or another. It doesn't mean there's something wrong with you. It just means that you have more of an opportunity when you don't wear proper shoe wear that it could potentially hurt. We just need to make sure that you're always taking a look at your feet. That's the number one. So you're looking at your feet. And when you stand, let's talk about it. If you're in your bad posture, you know my thing about bad posture. Where's the weight in your feet when you have that bad posture? Well, all of a sudden, all of the weight goes to the front of your foot. We don't really always want it in the front of your foot. At times you need it in the front of your foot, but not all the time. So it's really important that we do things to make sure that your posture of your body actually affects the posture of your feet, so that we're putting pressure equally on the entire bottom of your foot, not just on the ball of your foot or not just on the heel of your foot. It's really important that we take a look at that, because that alone, poor posture, can cause your feet to hurt. If you're wondering, I did nothing today, I just wore heels and I stood on my toes all day. Well, that could cause you to have pain for quite a while in your feet. Let's talk about what we can do to fix this. If you're standing all day long, you got to be wearing proper shoes, okay? You also take periods of times where you take a seat or move your foot. This is not, you're still standing, but you can still move your feet. You can also stretch so easily by just bringing one foot up, putting your heel on the ground and pulling your toe towards your nose. Now think about that big toe, really pull that big toe towards your shin. And now you're stretching actually the big toe, the arch, your heel, as well as your calf. Now, if you're super flexible, you might not feel a stretch. In my opinion, I can already feel one. And if I were to bend forward, I'm gonna feel a stretch all the way in my hamstring, into my calf, and into my arch. So it's really important that you understand you can do this all the time. You can stretch it, you can work your calves, you can work your feet just by standing differently, changing your position and not standing in one position all day for hours. Same thing with when I talk about sitting. We don't want you to sit in the same position for 8 hours. Same thing goes for when you stand. The weight should be evenly distributed across your foot. So all of you stand up. There you go, stand up. Now feel where your foot is in the ground, okay? So does your toes touch the ground? Are you actually feeling the ground, the carpet? Can you feel your feet in your shoes? Can you wiggle each one of your toes? Okay, now let's move to the ball of your foot. Is the weight in the ball of your foot? Let me think about that. That's gonna be the padded area above the arch, okay? Now put all the weight in your heels, okay? Keep your toes down though, so you don't fall. And now you can feel all the weight in the heel of your foot. Now, let's equally put weight between your heels and the ball of your foot. If you do that, it's a really good balanced position for your feet. Now, we haven't talked about medial and lateral, meaning do you have too much on your pinky side of your foot or all on your big toe of your foot? And that, as you could see, has a lot to do with what are my knees doing? What are my shins doing? What's the rest of my body posture doing? So that's why it's really important to think about it. When you're standing for long periods of time, you don't want to have straight legs. Have a little bend. Allow the muscles of your legs to hold you up instead of just your feet doing all of the work. It puts unnecessary stress on there and it makes it potentially hurt. So we're gonna check that posture. We're gonna make sure you're really evenly standing and therefore you're gonna have less discomfort in those feet. My favorite part, we gotta stretch. How many of you actually stretch your feet? I mean, you might stretch your hamstrings, you might stretch your chest, you might stretch your low back, but your feet? You complain about your feet. Almost everyone complains about their feet. You get after a long day, you're like, oh, my feet are killing me. You rub the bottom of your feet for like 2 minutes and then that's it. So it's really important to think about how do we stretch? How do we make our feet feel good? I want you to make your feet a priority and see how much improvement the foot is, but also your whole body will have more energy. If you get a little spring in your step because your feet aren't hurting, you're gonna actually feel better. So really, it's important that we work on what's tight. And as I told you, there's a lot of muscles that are entering into the foot from the upper leg, as well as in the actual foot. So we've got to really work on how are we going to stretch that. So what we're going to do, and you're going to do it with us, we're going to leave some exercises with you, but I really want you to take your shoes and socks off. You can sit back down in your chair, okay? And what you're gonna do is you're actually gonna put your foot on the ground nice and flat. And you're just gonna see if you can pull your toes towards your heels. And you're just gonna try to create your own arch. Don't need any products, you don't need anything. All you wanna do is see if you can keep your foot flat on the ground and pull your toes towards your heel. And just see how that feels, A. B, if you can do it. Can all of the toes do it or only the big toe doing it? Can all the toes curl? All those things matter to tell you how strong your foot is. It's a super simple exercise and you can do it seated in your shoes or without your shoes. I told you to take your shoes off because I needed you to feel it. When you first start any exercise, it's really much better if you can have some tactile or stimulation of feeling the carpet or the tile floor or a towel so that you can actually feel yourself moving your toes and something actually is feeling like it's moving underneath you. It gives your body a nice stimulation or proprioception to let it know, oh wow, I'm doing something, instead of having to stare at your feet and making sure that you're doing it. So it's a really easy way to kind of understand what muscles are working, how does your foot feel, and what toes are actually not working. And you want to kind of curl and hold and do that about 5 to 10 times. So this will help those muscles wake up, okay, and stretch and strengthen all in one exercise. Super easy. You can do it at work too. You don't need to use a towel and you could be wearing your shoes and do it. So there's no excuses. You have to do it. And this will help you. There's also some great ways we can use outside things like resistant bands and things like that to strengthen more of the ankle and things like that. I love a piece of paper. It's the easiest thing to do. So if you tear up a piece of paper into little balls, I want you to then have a little cup, and I want you to pick up each little ball you made with your toes and place the ball into a cup. And that way you're actually going to see how your whole foot looks together and can move and find the cup and drop it off. So allowing your ability to curl your toes as well as to release your toes. I also want you to put that piece of paper that you didn't make into balls, okay, that's just a piece of paper flat, put it underneath your big toe. Try to hold that piece of paper on the ground. Don't let yourself pull the piece of paper away. See if you can use the strength of that big toe to hold that piece of paper down. It's challenging. It's way more challenging than you think. So try that out, and that will really help to see how you can strengthen and decrease some of the tension and the tightness and the pain inside of your arch and your pain, okay? The other thing I love to do is there's this thing called massage. I know you all know it. You yourself can massage your own feet. You can also use things like hypervolts. They're beautiful. You don't have to even touch your foot. And you can massage your calf and your arch for 5, 10 minutes and release all of the tension. I think the tendency is we think about big muscles and we go get a massage and people are like, oh, don't touch my feet. And that's wrong. We need to do that. Everything in your body, all your toxins, all of your stress, guess where it goes? To your feet. And the reason why is that's just an easy place for things to be deposited. And so we really want to make sure you spend just a couple extra minutes every day. A, looking at your feet to make sure there's nothing going on with it. B, make sure that it's not tight. So you're gonna stretch it. You're gonna massage it with your own hands, okay, when you're putting your shoes on. And then 3, you're gonna wear proper shoes so that you're protecting your feet. And I'm gonna talk about shoes later because it's one of my favorites. So we're gonna stretch. We're gonna, remember how I talked about this is weak, okay, and this is tight. So the biggest thing is we have to strengthen your shin muscles. So we haven't really talked about that. My favorite exercise, super easy, you're going to write the alphabet. Now, depending on your age, it's gonna probably be harder for you, but I love uppercase, cursive letters, and flowery. So like the A is a big letter with all these kind of curly cues, okay, and it's uppercase, and you're gonna go A through Z. Or if you have a really long first, middle, and last name, you can do that too. But A through Z 2 times, okay? And the only thing you are allowed to use is your ankle and your big toe. So the big toe is the pencil and your ankle is the wrist. And that is how you're going to make sure that you strengthen all of the muscles that attach to your foot and ankle and your shin. And it's a great way to strengthen it, super easy, and you can do it anywhere. Then you're gonna follow it up with, guess what? A stretch. And we're gonna stretch the back side of your leg, the calf. The calf can't be tight. How many of you get Charlie horses in the middle of the night in your calf? If you've worn high heels and gone to a wedding, I'm here to tell you you're gonna get a cramp in your calf, unless you wear them all the time. I wear sneakers all day long, so once I put it in a heel, forget it, it's gonna hurt. But you have to stretch that. And it's really important to do it on a regular basis. We also don't wanna forget, remember that water, that nutrition, things that we talk about every week. Yes, you gotta do that too, because it's really important. So when you're holding that stretch and that calf stretch, and you can do it sitting, you can do it standing, you want to make sure that you're allowing the stretch to actually take hold. So don't really rush into it. So you can literally do it standing. Right foot in front, left foot back. Make it straight, push your heel down and lean as far forward, not letting that heel come up. And you're gonna actually stretch the heel and the calf and allow it to stretch without moving, without doing anything different, and standing without any prop. And there's no excuses, so you can stretch it for 20 seconds and it will reduce your pain. And it's great to do after you've done the alphabet for your shin. Make sure we wear proper shoes. We're gonna work on our posture. We're gonna try to stretch, and we're gonna strengthen. Now we're gonna go, why? Why is it so important for my foot to be strong? Like, what's the big deal? Well, the big deal is this. It's one of the biggest reasons why, as we age, we lose our balance, okay? So what's the number one reason why people go to the hospital later in life? It's because they fall. And once you've fallen once, there's a 70% chance, increased chance, that you're gonna fall again within a year. And if you fall 2 times, guess what? That rate goes up exponentially. So it's really important to take all of the things we can do to decrease my risk to fall. And so therefore, we have to have better balance, which means now you gotta worry about working on your strength of your foot. All right, and so that's really important. The number 2 thing is your butt. So your butt muscles have to be strong, your foot muscles have to be strong, and that is gonna help you have better balance and allow you to decrease your risk for falling no matter what age you are, but definitely as you age. So let's talk about balance. It's super fun. It's about stability. It's about making sure you're coordinated, that everything is kind of working. Poor balance actually is weakness, okay? That's why we have it. Yes, we can have dizziness that can cause balance issues, but for the most part, balance issues are coming from weakness of our legs, of our core, of our butt, and our feet. So it's really important that we support all of those muscles and we actually work on trying to strengthen them. Actually acknowledge that we might be weak. Now, if we're gonna go for a balance drill, the best one, my favorite one, is we're gonna stand on one leg, okay? I can just stand here, one leg. You can see there's always gonna be a little bit of a movement and potentially at first be hard, but you wanna stand on one leg. You wanna brush your teeth. How easy is that? You brush your teeth twice a day, at least we hope. Okay, in the morning, you're gonna do it on your right leg. In the evening, you're gonna brush it on your left leg. Now, this is the trick. There's a counter in front of you. The counter's there to support you. Don't fall. That is not the point of this exercise. The point of this exercise is to challenge you, but always be in a safety net. So the counter of the bathroom is right there. You're brushing your teeth. It's a dynamic movement. You're standing on one leg and you're working on it. So in the morning, right leg, in the evening, left leg, and there's your exercise. It didn't take any time in your life. All is good and you worked on your balance. What else can you do? Well, there's so much more we can do. So we wanna really make sure that you're working and engaging all the muscles. So once again, you're sitting down right now. So all I want you to do is hold your stomach tight, squeeze it in, suck it in. I want you to squeeze your butt. Now I want you to stand up. All right, now sit back down. Slow and controlled. All right, no plopping. All right, now do that 5 times. Okay, now you've just strengthened your glutes, your quads, your hamstrings, your feet. You've worked everything. 5 times. That's all you have to do. So it's something so simple can actually work all of those muscles, because if you're sitting all day long, you've shut all those muscles off. So how easy it is every time you want to get up to go see a colleague or go to the bathroom or get a snack, okay? You do that 5 times. Stand up, sit down, stand up, sit down. And I'm not talking fast. We're talking nice and slow and controlled, and then nice and controlled standing up. All right? The more you just use your legs, the stronger you're gonna get. But if you need to use your arms, of course you use your arms. Other things, play a game. When you're walking down the street or when you're walking in your house, do different things. Can you walk heel toe? Okay? It's hard. Guess what? It's like one of the #1 tests, A, if you get pulled over by a cop, but also to get into say an assisted living home or an independent living home. They're going to see, what is your balance? Every physician is going to see, can you do that? They're going to ask you to stand heel to toe. How much do you move? Well, how often do you go in this position? We don't do it very often, so practice it. Make it part of your daily activities, and I promise you it becomes easier. If you do things more often, they're not so hard. They're not so daunting. They're not so, and you don't really know that it's like helping you significantly in your overall balance and overall longevity. So it's really important to do these simple little things randomly throughout the day, and they will help you overall to increase that strength in the muscle, make your legs and your feet work a little bit more. So can we talk about walking? All right, how often are you walking? Walking is the #1 way to decrease your risk for falls, for balance issues, for weakness, okay? It's not hard. It didn't cost you anything. Go out and walk. Even if you don't love to walk, then park 20 spots away than you normally do. Anything to make you use the muscles on a regular basis, all right? Focus on slow and controlled. Someone asked me today, is there a proper way to walk? Maybe not a proper way to walk. Is there a way we were taught? Sure, if I'm gonna work on someone in the clinic and they've just had a, say, total knee or total hip, and they're trying to relearn how to walk, okay? Because you have to relearn to do that after those surgeries. I always talk about keeping your stomach and your tush tight, okay? We call it suck and tuck. Everything's tight. All I'm gonna tell them is to pick up the hip, bring up the knee, kick out the knee, land on your heel, okay? I call it the hip, knee, heel. And if we do hip, knee, heel, and you can do it in the door jamb so you're not even moving, then you won't have to worry about your balance. You're gonna realize certain muscles that might not have been working or you had not been using. A lot of people try to walk on just their ligaments. So they walk very upright and almost leaning forward, okay? We really wanna use, these are strong muscles. So are these, and so are these. We gotta use them. So we tend to, if we've gotten injured without even knowing, unconsciously, stopped using certain muscles. So it's really important to make sure you kind of get this hip, knee, heel kind of concept in your mind. I love it in the door jamb, okay? Hip, knee, heel, landing, and then do the reverse and put your toe behind you. It's exactly how we walk, or at least how we hope we walk. So great ways to just work on slow movements and things that make you think, okay, I'm gonna actually walk. Sometimes we just kind of go out and we're not thinking. Don't get me wrong, I love that. But if you're challenged right now and your balance isn't great, or you're just not feeling like you can walk as fast as your friends, maybe we need to take a look at what's really going on and challenge it. So I love that drill. I just love the hip, knee, heel. I think it's great. And I think that it's a way for you to challenge your own body and kind of figure out what's not working. Because to be real, you know there's an issue, yet you don't say anything or you don't go to the doctor and ask. If you always walked with your girlfriends or your guy friends and all of a sudden you're not keeping up with them and you're feeling like you can't keep up and you're wondering, well, it must be because I'm shorter or I don't have as long of a stride or, oh, I hurt. You know, it could be that there's something so simple we could fix by a muscle being turned back on, then you could go back and walk. And you don't want to lose that social engagement that you have had, because that's really the reason why we like to work out. It's what creates our longevity. It's what makes us feel better in a day, is to be able to do the things that we always have been able to do. So I think it's really important that you just go out, accept where you're at, and then find someone that can help you if you're seeing that you can't do these things. So simple things we're gonna work on, okay? If you have foot pain, we wanna make sure we fix it. We have to address it. We gotta figure out, where does it hurt, okay? Is it the top of your foot? Is it the arch? Is it the heel? How long has it been hurting from? If you put on certain shoes and it doesn't hurt, make a note of that. Maybe don't wear the other shoes. And also, let's look at your posture. How are you standing? Are you putting all the weight on your toes or your heels? All those things are super easy things to kind of check yourself and make sure that we're just making small little changes to make it helpful for you so that you can walk better. By correcting your posture, by strengthening your feet, by strengthening your muscles, by doing 5 sit-to-stands, okay, incorporating maybe a little bit of balance every morning, and you should be able to do this. So right now, if you stand up, can you stand on one leg? Can you do it without holding on? Of course, I don't want you to hurt yourself, so put a chair by you, have the couch in front of you, do different things to make sure you can do it, but make sure you're stable. You need to be stable, and this will help your feet, A, feel better, your body feel better, and you have extra energy because it's not so hard for you to walk. all those muscles are working. So in the long term, it's really important to deal with small little aches and pains now, not like 6 weeks later, like all my other patients come to me. If you came to me in the first week, we could fix your feet so much easier. And the biggest thing, we're gonna talk about sneakers, because me and myself, I have to just tell you, shoe wear is everything. You need to look at what you're wearing. If your feet hurt in the shoe, get rid of the shoe. I'm sorry, I know you bought it, I'm sure it's beautiful, but if your foot hurts and you haven't even walked, it is not the proper shoe. The shoe should fit your foot. So please, what you wear on your feet matters. If you wear those cute little flip-flops that have a zero arch and no support, you can only do it for a short amount of time in your life, and you will be very upset that you did it for the rest of your life because you're losing your arch, you're decreasing the strength. I know there's this whole theory out there about wearing barefoot and working out barefoot and doing all these things. Guess what? If we never brought shoes into the world, I would totally agree with you. Barefoot is the way to go. But we did bring shoes into the world, and really, to get serviced, you usually have to wear shoes and a shirt, okay? So, shoes, we wear them. So let's use what we know. The technology is amazing what we can do. If your feet hurt, we can probably find you a shoe to make your foot not hurt. Don't keep running or working or walking or doing in a shoe that hurts. When you put a shoe on, it should go, it should feel good. And if it doesn't, it is not the right shoe. So that's what I have to say, and I will definitely help you with that. And I think that if you go to the app, you can sign up for me and we can actually do an analysis. So we can watch how you walk. We can see what's not working. We can actually take a look at your shoes and say, ooh, those are not the right ones for you, and give you suggestions of why you might need other shoes for the activities that you're doing. I understand when you want to get dressed up and you want to wear those beautiful high heels and you know your foot hurts, you're going to wear them for a small snippet of time. I'm okay with that. But for the majority of your day, you need to wear good shoes. So try these exercises, try standing better, try wearing shoes that fit, and I promise it's going to help on the overall component for you. So take care of those feet and take a look at the app, and you can find all these exercises there, and we're going to see you soon.